Welcome to Ask When, you guys. I have Marie with me, and Henry is a urologist. And how I came across Henry's name is I will give the as a silent partner in crime here credit because his wife Madeline, who already had a fabulous podcast episode, wrote a book on Henry's subject, which is urology. And so now I want to deep dive into urology and what we can do to break the stigma of having urology problems, basically, because what Madeline said is a lot of people, well, of course, a lot of people don't tell you what is going on in that area, Lily. So now I want to break the stigma with Henry, and I have a couple questions for Madeline too. So she's going to chime in when she can, and we're just going to see how it goes. So, Henry, first of
Mhm.
all, welcome. Second of all, how did you get into this field of being a doctor? I mean, it's a fairly unique field. Also, it's a common thing I'm coming to find out. Thank you very much by your wife. It's a very common thing, and
Yes.
it's a niche in itself. So, how did you get involved with this?
So by now, what I think is a gene that is being passed from generation to generation because my grandfather was a urologist and my father is a urologist who recently retired. That tradition, I think, going to be broken with my two kids who have expressed no interest in urology so far, or
Oh,
in medicine, in fact. So, so
oh,
that
yeah, that
yeah.
tradition has to be broken somehow.
Yeah, so which is fine. They are looking into things that interest them, so which is it should be the way the way it should be. And in no way, by the way, did my father or my grandfather influence me in wanting to become a urologist. Something that seemed natural. I was exposed to it at an early age, and I followed through. And it's one of the great decisions that I made. Having a great impact on people's lives, and I enjoyed what I do tremendously.
Oh, yeah, right. Dad can't influence you. Oh, yeah, right, Henry. Oh, yeah, right. You say that without putting the plug towards your father, but how you grew up, how you guys grew up is what you what your parents model is what you will eventually see and what you will eventually do.
Yes, I agree completely. Yes. So,
And so what is the one of the biggest stigmas about urology and the urology field? I mean, I until I met Madeline, I didn't even know this. Well, of course I did because of my disability, but I didn't even know this was a huge topic as to say, okay, you need to get these problems fixed if you want to have a functioning life. So,
mm,
what is the biggest stigma out there that you want to break to my audience?
yeah. So is yeah, like specifically urinary incontinence is an incredibly common condition for a variety of reasons. Over 35, 36 million people in this country suffer from urinary incontinence, and there's several different types. What is called urgent incontinence, which is the feeling the strong urge to go to the bathroom and not being able to make it in time. There is the stress urinary incontinence, which stress in this context means activity related, coughing, sneezing, exercising. There's what is called mixed urinary incontinence, which has a component of both of those types of incontinence. And usually you address the component that is most bothersome first, and then secondly the urge component or the stress component. And what is unfortunate is that people will live with this condition because they're very afraid to discuss it with anyone, especially their doctors, which is the most unfortunate part. Now, there is an excellent treatment for all the conditions. There's what is called bladder overactivity or overactive bladder. The syndrome is of urgency frequency, with or without urge incontinence, and with or without nocturia. Nocturia is getting up at night to urinate. So and by the way, it is getting much, much better. We have several organizations that are advocates and that have emphasized educating the public. And because of that, more and more people come in with to be treated and to at least discuss it. Bottom line is that there is very effective treatment. It ranges from very conservative treatments. Unknowingly to the patient, they do a lot of things that make their condition worse. And then addressing those issues immediately have a dramatic impact. There are excellent medications that can work very well for this. There's a physical therapy that can work very well. This physical therapy is what is called pelvic rehab or pelvic rehabilitation that is dedicated to a focus on the pelvic floor muscles. There are surgical procedures that can be done. There are other procedures. There are even, and you probably would never heard of this, but you know that a lot of people get pacemakers for the heart, because they have an irregular heartbeat. Well, there's a pacemaker for the bladder, that is called InterStem. And there's one other that just came in the market after InterStem being around since 1995. One other company developed another type of pacemaker. You also have probably heard of Botox, people injected in their faces for the wrinkles, so on. Well, did you know that the only FDA approval of Botox is to inject it in the lining of the bladder to treat bladder overactivity? And especially if there's a neurological.
I did not know that. See, there we go. You teach me something every single day. I did not know that. I did not know there was a pacemaker for that area too. And now to give myself a little example, I had, and Madeline and I talked about this on my podcast. I'm thinking, okay, there isn't something wrong with me. I'm thinking it's going to be interesting what they say when I go to the urologist as an adult, which I'm planning to, you guys. I'm planning to go to a urologist because I want to see. I had scoliosis surgery way back when in 2006, and I know that previous to my surgery, I know that incontinence was a big, huge mess for me. And so but I ended up still having it. And this is after the scoliosis surgery. So I want to see once I do end up going, what they recommend for me, because I have a neurological condition, and so I want to see what they recommend for me, because now I'm now I'm thinking, well, maybe it's not a squished bladder. Maybe it's something different that I can actually help and heal.
Hmm. So in your case, there are several factors that can be contributing
Yeah.
to your condition. First and foremost, about 30% of patients, on average, 30% of patients who have cerebral palsy the condition will affect the bladder, regardless of whether you have scoliosis or not.
Okay.
In general, any condition that affects brain function or central nervous system function will, in fact, affect. We have just a quick anatomy question lesson. We have some voiding centers at the base of the brain that are affected by different conditions. That is then, neurological conditions, so that
Yeah.
includes cerebral palsy, Parkinson, MS, multiple sclerosis, surgeries in the brain or the spinal cord, tumors, anything in that area will essentially release those controls that we have in those voiding centers. And essentially, in a nutshell, it makes your bladder a little bit more independent, so that when you try to exert that control that you normally have, you don't. It's much more difficult. So that's why the bladder tells you, I want to go now, and there's nothing you need to it can do about it, and you go. Now, when you have the scoliosis, yes, you probably have, if it was very severe, some what is called compression of the bladder, which decreases its functional capacity, meaning that instead of holding the normal, which is, let's say, 400 to 450 cc's of urine, because it's being compressed by the rest of the organ because of the curvature, then it decreases that amount so that the bladder fills up quicker, so you have to go more frequently. Also, the fact that, any surgery in the spine can certainly affect the different bodily functions, and it can certainly be related to that. So, as you see, it can be any of those conditions, but if you had it before and you still have it to the same degree, maybe a little bit worse, then you can certainly, it can be just the cerebral palsy. The bottom line is that regardless, and by the way, the degree of incontinence and the degree of affliction has to do with the severity of the condition. The worse the cerebral palsy is, the worse it affects the bladder.
Okay. So my cerebral palsy is certainly on mild, certainly not severe enough where I can't control it, but it's moderate cerebral palsy. And so, yeah, that answers my question right there, you guys. It has nothing having to do with the scoliosis. The scoliosis just was a component that made it worse. And now, since the scoliosis is fixed, it's a little bit better, but because of CP in general and because of how my brain works, we
Mm-hmm.
have another component that
Mm-hmm.
you guys didn't know about until today, because yeah, this is how I teach myself about disabilities. I always thought I always thought that it was scoliosis. I always blamed it on scoliosis, and I
Yeah.
didn't realize that, hey, it may be me and not having to do with the scoliosis surgery or the scoliosis itself. I never realized that because of my condition in general.
Mm-hmm.
Yes.
Yeah. The important point of all this is that uh, it can be helped. Again, you may be doing things that are making it worse, and just to list a few of those things, like, let's say coffee. Coffee is what we call, so there's a category of foods and drinks that we call bladder irritants that should be avoided or minimized if at all possible. And they include coffee. If you drink coffee, and I'm a coffee drinker, I have a cup of coffee in my hands right now. But if you drink it in the morning to wake up and get going, then and that's okay, because that effect will be completed probably in about 2 or 3 hours. But if you do it during the day, and you notice that when you drink that coffee during that period of time, you may be going a lot more frequently to urinate, even if it's small amounts of urine, until that effect is gone. Now, but there are other things. Let's say that tea of any kind has a lot of what we call bladder irritants. Juices, you probably have heard that cranberry juice is good for the blood and for the kidneys. Well, in bladder overactivity or urinary incontinence, it's probably one of the worst things you can drink, because it's very acidic. And so the urine that is composed from drinking cranberry juice is very irritating. So any little amount just exacerbates the condition by stimulating the nerve endings of the bladder. So you constantly, the more you drink, the more you're going to go. So the worse you're making it. Also,
amazed.
yeah,
Really?
yeah.
That
Also,
shocks me, because I've always been told that to get rid of a UTI, you must drink cranberry juice. And now I know better. Thank you, Henry, for that lesson. Because
now,
I always thought, well, cranberry juice is great, but at the same time, I always didn't believe in it, you guys. And the last time I had a urinary tract infection, it wasn't good. And so I am going to be careful how much cranberry juice I drink. They say water now is drinking a glass of water, which we should do in general, a bladder irritant, or does it flush it out?
so that's a great question. I'm glad you asked it, because, by the way, if any other juice that is acidic, so, cranberry juice, orange juice, grapefruit juice, apple juice, all those things are irritating. But to answer your question, so, most people have heard that, oh my God, you need to drink 8 glasses of water a day, or you're going to ruin your kidneys or your bladder. Well, that's the biggest nonsense I've ever heard in my life. That's not based on science. Somebody along the line came and told you that you need 8 glasses of water. Well, in a person with a bladder overactivity, that makes it 10 times worse, because you're going to essentially live in the bathroom.
Yeah.
The body knows when it needs water. It makes you thirsty, so you should drink water with your meals. You should drink water when you're thirsty. If you're taking medication, drink water with the medication. But if you're not thirsty, don't force it. In this condition, don't force it, because you're making yourself worse. Also, Coke, any carbonated drink that you drink is very irritating to the bladder. So don't drinking that is guaranteed that it's going to make your symptoms worse, and it doesn't matter what kind. Some people say, oh, but I drink one that is clear. Well, it doesn't matter. All the chemicals are essentially the same. Now, going back a little bit to the cranberry juice, in order for cranberry juice to be effective against urinary tract infections, you would have to drink something like a gallon of cranberry a day, which is obviously impossible. I don't know anyone who can drink that much, so that enough of the ingredients would be effective against urinary tract infections. Okay, or you would have to drink several pills, cranberry pills a day to be able to be effective.
Yeah.
Now, it's not feasible. No one can do that. Now, some very small people in Europe did a wonderful research and found the active ingredient in cranberries that is effective against in prevention of urinary tract infections, and they actually made it into a pill. There's into a little capsule, and you can take that. It's like taking a supplement daily, and it prevents. And that this is based on science. They've done actual randomized placebo-controlled studies, which is the gold standard of scientific studies to compare, and found that these medications is very effective in doing that. And by the way, I have no financial interest with this. I have I've seen the science, and I recommend it to my patients. The only essential supplement that I recommend, because it's based on science, and for your listeners, it's called Elura. This medication, and it's spelled Ellura, Elura. And that is based on science, and it's safe. By the way, no known side effects because it's coming out of cranberries, and you can get it. I think you can get it on Amazon or on the website from the company once you put Elura. So a little bit of valuable information that can help patients with recurring urinary tract infections that is safe and effective.
Yes. I actually, well, a year ago, I actually took um something similar to oil because I had one. I can actually feel when a urinary tract infection comes on, and I actually said to, because I didn't want to do the whole cranberry juice thing. Um, I actually said to one of my team members, I have a urinary tract infection, and I'm like, oh boy, here we go again. What am I going to do this time? I'm sick of the whole cranberry juice thing. She goes, I am going to give you a cranberry capsule. And I'm thinking, oh boy, here,
Hmm.
what? What is this going to do? Do you know it worked? You guys, I'm
Mm-hmm.
like, okay. And I'm like, okay. So now I know when I have, because urinary tract infections and cerebral palsy are match made in heaven, unfortunately. And so
Yeah.
now I know that when, and she gave it to me straight up too. And so now I know that when the urinary tract infection comes on, I pretty much know to take the cranberry capsule over the cranberry juice, because the old wife's tale for my condition doesn't necessarily work because it irritates bladder.
Right. And by the way, Elura works best as a preventive. By the way, if you take it, it's unlikely that you can get another urinary tract infection. That's the beauty of it, because it's like taking a vitamin, because it's made out of cranberry juice. So if in this scenario, if you get, especially in patients who get frequent urinary tract infection, or what we call recurring urinary tract infections, which is defined essentially as more than 2 or more urinary tract infection in a 6-month period, then that's when it can do its job best. You take it as a preventive, and they actually go away.
Now,
So
do
it's
you
a consultation. Go ahead.
do you recommend that patients take it every day as part of their everyday pills, or how?
Yes, every day.
Okay.
You
Every
take it
day.
just. Yeah, if you take vitamins or you take another medication, you can take it together. it doesn't interfere with any of the other medications that you may be taking.
Yeah. Yeah, because I know a lot of people who have cerebral palsy take medications for cerebral palsy specifically. And
Mm-hmm.
so, yeah, a lot works, you guys. And you can find it at Amazon or Whole Foods. Just look
No, no,
for,
it's not Whole Foods. You wouldn't be able to find it. It has to be from their website, the company's website, which you can get through by researching Allura, googling Allura, in Amazon. That's the only two places that I've seen that my patients have been able to get
okay.
it. But it's not widely distributed to pharmacies or any food stores or anything like that, or any other supermarkets. They want to keep the exclusivity, at least for now. And I was surprised when one of my patients, by the way, told me that they were getting it from Amazon. And I said, let me see, because I wanted to make sure it was not substitute, because if you look at cranberry pills, you will find hundreds of different types of one. None of those really work because they just don't have enough of the active ingredient to be effective unless you take the numbers that we mentioned. So it has to be this one specifically. And again, no financial interest. I just want to make sure that your listeners, I use it because there's science behind it. It's not that someone just pull it out and say, "Oh, this is cranberry
No.
pill. It's going to take away your medication, your urinary tract infections." One other quick point is that there is a very high association between urinary tract infections and urinary incontinence, especially if the incontinence is severe enough to have to wear protection, any pads or diapers or anything like that. Then there is a very high association between the two. So treating the incontinence will lead to also decreasing or eliminating the urinary tract infections.
Aha. Aha. Okay, now we're getting somewhere because
Mm-hmm.
I had a ex-aide of mine. I have cerebral palsy and require 24-hour help. If you guys haven't figured that one out by now, you should. But I had a ex-aide of mine. She was no, she was in this house 2 minutes, and she asked the aide who was cleaning her. She goes because she saw Depends under the sink. And I have Depends for my period. I don't have Depends for the incontinence problem. But she made me feel like she almost made me feel in motto or something because she automatically asked my aide. She goes, "Does Win wear those for for incontinence problems?" And I'm like, I haven't admitted my incontinence problems publicly yet because up until today I didn't admit them because it's a very embarrassing thing that you have to do. And I'm like, no. And my aide, who was training her at the time, says, no, we use
Mm-hmm.
them for other women issues. But so many people think that incontinence is incontinence is incontinence, that it's not curable and it's just the way it is. Now, with cerebral palsy, it's just the way it is, but it is curable.
Yes, completely. And that's again, uh, so you can assume that 30% of the patients that in your network that are with cerebral palsy are having this condition. And again, the more severe the condition, the more likely to happen. Uh, and that's what I was mentioning in my opening remarks, is that patients are embarrassed to discuss it, not realizing that, you know, there's there are excellent treatments, and depending on your particular situation, uh, how wonderful it would be if you have to stop having to wear Depends or any protection that you're using right now. How wonderful if you could
Yeah.
prevent urinary tract infections. It ranges from, again, just behavior modification to medications to some procedures. Rarely in this condition is surgery. Rarely. It's more simple outpatient procedures. Is what is called third-line treatments, which includes, by the way, that Botox injection that I mentioned.
Yeah.
I'm very glad that we're having the discussion, because if we can get, you know, 5 or 6 people that can go to the urologist and seek help, and preferably, a reconstructive urologist, or what is called a female pelvic medicine and reconstructive surgeon, which are what we call the fellowship trained urologists that have specific training in these areas, is who you need, because they're in tune with this. Immediately when you tell them the condition, they know. They know. They say, "Oh yeah, and they know what questions to ask." What in the majority of the cases, very few tests are required. If the condition, especially in CP, if it's severe, they may want to do an ultrasound of the kidneys, because the condition can affect bladder function so severely that can damage the kidneys, and those patients require at least yearly evaluation to make sure that their kidneys are protected, and that interventions are instituted prior to permanent damage. So, but also, did you know that, in severe cases of cerebral palsy, that it is essentially recommended to be evaluated by a urologist on at least a yearly basis to make sure their kidney functions are
Geez.
done.
Okay. Okay. You're making me sound, and as you were sitting there talking, I'm like, well, when's the last time I went to see a urologist? When I was little? Jeez, you're making me feel bad now, Henry, because I now need to go work on that. I've worked on everything else. I've worked on my mental health. I've worked on PT, and now I need to go work on the inside of me, because I no no one told me that up until today, and it's public. So as soon as I make a move here um to the East Coast, to you guys, guess what I'm doing? I am actually going to find a urologist, because
Mhm.
I now need to go find one. And so it's like, oh boy, Henry, I just got caught with my hand in the cookie jar, Henry, because you just said, well, Wendy, you probably should go see one before
Mhm.
something else happens. And now the last time I probably saw one was when I was young, if at all. So yeah. So as soon as I make this move, I'm going to go see a urologist and figure out how
So,
much damage I ever done.
well, that tells me that I've done my job, and that makes
Oh
it
yeah.
all.
Oh yes,
So,
you have, because I'm like, oops, oops. Here I am focusing on everything else, and focusing on everyone else, and I don't. I knew I had incontinence problems, and I have mentioned it to my doctor, and I No, I haven't. I haven't mentioned it to my doctor. The last time we had a conversation about that, that was for something else. So I am guilty, you guys, of not mentioning it to my doctor. Hello,
Mm,
I am one
yeah,
of the thousands of Americans that doesn't want to talk about that subject because it's embarrassing.
yes.
Okay, now I need now I need to back up my stuff here and go to the appropriate doctor once I move to the East Coast, and then once I get it done, it will all be good. But I wanted to tell you guys, for those of you who are suffering from incontinence, whether you have cerebral palsy, Parkinson's, um, MS, you name it, there is cures out there. You just need to go find a urologist to help you. And Madeline and Henry are in Texas. I they actually handed me one out in Colorado, which I won't use now because I'm moving to the East Coast. But guess what? As soon as I get down to the East Coast, I'm going to find one because I need to go meet with one, and this ought to be
Eh,
interesting. Uh,
what, I'm sorry to interrupt you. Did you say you're in Colorado?
I am in
Oh,
Colorado until August.
okay. So one of my very best friends and one of the best urologists you could possibly see is in Colorado, is in Denver.
Yep, yep.
And he trained with me at Duke. We did our fellowships in Duke University, and his name is Brian Flynn, Dr. Brian Flynn. He's at University of Colorado there. He is one of my very good friends, but he's somebody to be trusted, and he's an expert in this field. So if you want to see someone that can help you right away, that is him.
Well, I appreciate that. And your lovely wife handed me that name. I just haven't dealt with it yet. See, I don't want to deal with this subjects, you guys. I
Yes,
don't want to deal with this subject. And
sure.
like you guys, I don't want to deal with this subject. So,
So
Henry,
that's exactly why Madeline wrote the book, because it's so difficult and she presented it in such with such humor and with such like language that it makes it easier to read and then hopefully get some people to address their issues.
yeah, yes. And that's why Madeline brought you on this podcast so that we
Hmm.
could have a deeper conversation about it. So, Henry,
Yes.
where can the people find you if they want, if they're in Texas area and they want to get a hold of you?
So I'm here in South Texas, in McAllen, Texas. I'm in the Urology Institute at Renaissance. There's a phone number they can call if they wanted to talk to me. It's 956-362-8767. And to ask for my assistant, Areli, her name is Areli, it's Areli, and she'll find me wherever I want, wherever I am, or take a message so that I can return the phone call.
Well, isn't that wonderful? And I wish you guys, both of you guys, Madeline and Henry, the best success in your journey. I mean, Madeline, you talked about the book, and Henry, now you did an actual deep dive on my podcast. So you guys, you you have to get this problem solved. Um, you have to go pick up Madeline's book along the way, and so and you have to get this problem solved. Otherwise, we're going to have this underlying condition that drives all of us nuts. And then we're going to have to break the stigma about why we wear protective gear, because I want to break the stigma. I want to raise awareness about disabilities, but I also want to break the stigma of how a disability actually works. And so I thank you guys for coming on, and I thank you guys for listening. And I hope that you're able, through Madeline's book and through what Henry said, I hope you're able to have that conversation with your loved ones about this very sensitive subject, because, as we said, a lot of Americans and a lot of people worldwide don't go to their doctors and don't fess up. And after this podcast episode, I'm going to start fessing up to my doctors, and it's going to be a very interesting journey. But I appreciate you guys listening, and I hope you guys enjoyed another fabulous episode of Ask Win. Thanks, you guys. Bye, you guys.
Bye. Take care.